If you have tried treating your arthritis-related discomfort with pain management, but it's just not working anymore, you may want to consider surgery. According to rheumatology.org, approximately 418,000 total knee replacements and over 220,000 hip replacements were performed in the U.S. last year. These numbers continue to grow as our population ages. The specialists at the Florida Hospital Waterman Joint Replacement Center explained the different surgery and treatment options they offer arthritis patients.
Arthritis can be crippling, disabling, depressing, especially when it's involving the weight-bearing joints. There's nothing worse than not being able to be active. When it gets to the point where somebody cannot go down to the end of their driveway to pick up the mail, or they even can't get from their bedroom to the kitchen, let alone go out and exercise, go to the movie, take that trip. When it gets to that point that their activity has been so much decreased, their lifestyle has been altered so much, they really need to consider having some kind of joint replacement to get that fixed. The problem is, the more arthritis you get, the more pain you can get, pain or instability. And I might add that some patients, even though they have bad arthritis in a joint, they may not be hurting that much. They're born with a high pain threshold, but they have a knee that's unstable. So then the concern becomes, okay, are they going to be walking down the sidewalk, the knee gives way, and they fall and break their hip? So the two things that you get concerned about is pain and instability. But having said that, if their lifestyle is being altered to that degree, what typically happens is they become less and less active. As they become less and less active, of course, they're sitting and riding instead of walking, standing. The rest of their body gets in worse shape, not just the rest of their joints and their musculoskeletal system, but their cardiovascular system, everything starts to get worse. As they get more and more out of shape, they're doing less and less still, so it becomes a catch-22. And then, of course, the emotional part comes in. They start getting down in the dumps, they start getting bummed out, they start getting depressed, their spouse starts getting depressed, because the spouse is going to do things and they're sitting here and they can't do things, so it just becomes a very bad downward spiral, physically and emotionally.
You'll find a link to more information on the treatments offered at Florida Hospital Waterman's Joint Replacement Center when you click the Joint Replacement Story Link icon at yourhometownhealth.com.